I see, and I do believe we have Dr. Dan Edney, State Health Officer, with us. Good morning, sir. How are you?
Good morning, Paul. I'm well. How are you doing?
Doing fine, and I thank you so very, very much to come in, especially during this time of the year. Getting guests to say okay is not as fast as it used to be a couple of 3 weeks ago during the Christmas season. But I love your tie, sir, and thank you coming. I was going to see if I could find
He's no Kevin Blackwell, though.
What do you mean he's no Kevin Blackwell? No. Kevin had a jacket that I think you plugged in. As a matter of fact, they probably had to have some kind of warnings when he came into the building to make sure he was deactivated. So, well, it's good seeing you. I know last year at this time, or at least a couple of years ago, this Christmas is going to be busier than normal for you, but a little state of affairs and how things going at the Department of Health.
Well, I've learned it's never a dull moment at the Mississippi State Department of Health.
Understatement, huh?
I'm finishing up my 5th month as your state health officer, and I promise you, Paul, it feels like 5 years, but I'm not counting.
Well, where are we? First of all, let me get this out of the way because we just did the story, and I said I was going to do it. So before I forget here, and I haven't even had any eggnog this morning, the norovirus, am I pronouncing that right?
That's
N-O-R-O?
Right.
And apparently we've had 9 cases. State health officers are saying that it's caused from raw oysters. Any report on that?
Yeah, they're from contaminated oysters off the coast of Galveston and the TX1 oyster bed. It's actually in deep water, so it's not like it's right next to sewage outlets, so we're not sure what caused the contamination.
Yeah.
But all the Gulf State area restaurants typically will order from that area as well as others. And so every state in the Gulf Coast region has had outbreaks. Louisiana's had 40. I think it's all the way over to Florida. Alabama has had several. Florida's had about 40. So right now, we're advising no raw oysters because this can be difficult for somebody to know if your raw oysters from the TX1 oyster bed. So best thing is just go ahead and cook your oysters that you're having at Christmas this year. My daddy loved oysters at Christmas.
If you cook them, would that mitigate the problem there?
It will.
It will.
I had fried oysters last night. They were wonderful.
Oh, did? Okay, good. So if you're eating at, let's say, one of the oyster places at a restaurant, just to bypass the raw oysters and get the.
That's right.
I think they pulled some kind of inspection on these oysters when they go to market. Before they go to market, I think that's one of the requirements, but I don't know how they do that. So you wouldn't normally know if a raw oyster is contaminated or not until it's too late.
No, and the norovirus is not a deadly virus. It's something you don't want to get. It's going to be vomiting and diarrhea illness. But every year we have people die from Vibrio contamination from raw oysters, and that Vibrio is a much more serious bacterial infection that we can get from oysters.
Let's talk about the flu situation because I just got my flu shot, the better half and I, a couple of 3 weeks ago, and it's always easy to do. Where are we with the flu across the state of Mississippi this year, this time of the year?
Looks like we're starting to turn the corner. We had a very early flu season. It came on strong, came on fast, came on very strong for our higher risk populations, and especially our folks 65 and older. But thankfully, the vaccine, the flu shot, is covering the strain very well. And we got very, very tight with hospital, mainly ICU beds the last 2 weeks. Mainly, we had to deal with RSV, but that's moving out of the state pretty well. Then at the same time, the big flu outbreak strained our hospitals. That's starting to turn the corner. But COVID hospitalization numbers are going up, nothing like the last 2 years. And if flu will go ahead and get out of the way, I think we'll be more than fine. ICU beds are starting to open up a little bit. The main reason we're so tight, though, is the fourth, and that's that we still have a severe staff shortage in our hospitals across the state.
That hasn't gotten any better at all?
It has not. That's still a direct result from the pandemic. And it's a big burden on our hospitals who continue to have severely high staffing costs.
I hear about it every single day.
Inflation.
Is it doctors and nurses, or more so nurses than doctors?
It's mainly nurses, respiratory therapists are the two highest level that are in demand, mainly because of the traveling contracts around the country. I think most physicians, there were some physicians who traveled under contract to other areas, but most physicians stayed in their home communities. But we still have a lot of nurses who have not come back from their travel contracts. And then we have a lot of nurses who just had enough. The pandemic was one bridge too far, and they've gone to the house or gone to other situations. We don't have a nursing shortage in general. It's hospital nurses, and especially ICU nurses.
Have you been able to see, or I don't even know if you track this, as far as the nurses that are being trained in our state and the different universities or wherever they're trained in the state? Is that number holding steady, that we at least have in the schools ready to graduate soon, or is that number down?
No, I believe our nurses in training numbers continue to hold steady. We still have a lot of nurses choose to move on to the master's level and look at becoming APRNs. And then we have a lot of nurses who choose alternative careers outside of the hospital. And thankfully, we have the need for nurses in public health. So, lots of opportunity for nurses.
Well, and it's a very, very good salary. Even though if you decide not to be a traveling nurse, I mean, it's a great occupation, and hopefully that'll mitigate itself in the future. Geez.
Well, one reason our hospitals are struggling right now, especially the rural hospitals, is that the overhead is so much higher than it was 3 years ago, mainly because of the cost to provide hospital nurses. They have to compete with the travel contracts. You can't just pay what you paid 3 years ago, or you'll have no nurses.
Well, we did have a settlement between the insurance company and the hospital, so that's I'm not sure if you want to speak on that one, but that's at least not going to follow us into the 2023 year, and that's good news.
All right, we're all glad to see that.
Yeah. COVID. You said we have an uptick on COVID. I saw the numbers this morning, and they are up, and rather dramatically. Is it the same strand, or how do you compare the ascension now compared to before as far as strain to strain?
We're still in the Omicron family. We're seeing small variations within Omicron, and that's why we have developed the new bivalent booster, which specifically covers the original wild strain that we all were vaccinated with initially, but also covers the Omicron variant fairly broadly. So my wife and I have had our bivalent booster, and that'll give us good coverage through the wintertime to protect us from the Omicron variant.
Is this made by any of the same three people, or is it a different maker?
The bivalent vaccine is both Moderna and Pfizer.
Is both of those?
Yes.
Is that kind of like a flu shot, just once a year, or?
Paul, we just don't know. COVID is doing what it wants to do. I'm just grateful we're not looking at the horrible surge of the last 2 years. I think that's mainly due to community immunity being so much better than the last 2 years.
What's the severity of this strain?
It's, Omicron is still fairly low in virulence, so the vast majority of people do well with it. But as you can see, we still had 20 Mississippians die in the last 7 days. Most of those are older folks with comorbid conditions. But what we're reminding people, don't go to work sick, don't go to church sick. For whatever you do, don't go to family Christmas sick and give grandmama whatever you got, because it could be the flu, it could be COVID, and she may not do nearly as well with it as you're doing.
Yeah. Still no over-the-counter medications or anything like that could be taken?
We still have plenty of therapeutics available that are widely available in pharmacies across the state. Paxlovid is the best therapeutic for COVID. Molnupiravir is also very effective. You can get those under health department protocol without a prescription if your pharmacy is willing to do it, or they're available statewide.
Listen, hang on for another segment, a couple of other questions for you, and give you some final thoughts here, and we'll do that with Dr. Dan Edney, State Health Officer, who has the award for the Tie of the Morning. So there we are. If you're watching C Spire TV or SuperTalk TV, it's not on yet, but it'll be on in a moment or two, so hang on for that. We just haven't plugged them in yet. Back with more coming up next. Well, hopefully, no frozen pipes out there, but I was just thinking about this. Did we have an uptick on illnesses during that whole situation in the Jackson area, Dr. Edney, as far as people getting contaminated drinking water?
We did not, thank goodness. And certainly once we came off boil water notice, then the water was safe to drink. It's as long as you were not pregnant and over 6 years of age. So we've not had any contaminated water in quite some time.
Anything that you want to mention as far as the 2023 legislative session that you guys are working on and maybe through the summer to prepare for the upcoming session in January?
We'll just always remind our friends at the Capitol that public health is indeed important. The topics you brought up this morning, be thankful we're there to handle these type things and so many more. And we fight to survive another year through our appropriation. You will see significant stresses on the health department over the next couple of years as we see access issues becoming more difficult, especially in the Delta. And we are intentionally strengthening the safety net, first in the Delta and the most impacted Delta counties, and then also Southwest Mississippi. And we'll have to pull funding from other areas to strengthen those county health departments and the services that we provide. But coming out of the pandemic, Paul, our top three priorities are, number one, to move the needle on maternal infant morbidity and mortality. We just cannot remain the worst state in the nation regarding mothers who are dying because they were pregnant and babies who are dying under 1 year. So that cannot stand, and we're putting intense resources there. Number two, on diabetes and its complications, which just causes far too much illness and death, premature death among Mississippians, especially in the Delta. And then third, the opioid crisis, working with Department of Mental Health as we see the number of deaths continue to escalate year to year, especially among our college-age students.
Fentanyl been part of that?
Is driving that.
That's unbelievable. And every time we get a story out there, it seems like they've kicked up the power or the makeup of fentanyl, but to make it even worse if that's possible. But and also mixing it with other things, something new and creative. So it is scary. At the same time, and I have a story here that we'll do a little bit later on Title 42. The border is just crazy. It's absolutely crazy is what's happening. And there's no way to catch people coming through who are polished, well-funded, and they know exactly what they are doing. But that's another story for another time. So it sounds like to me you're seeing that the funding for some of the community health centers is going to be less. Did you say that?
The stress on us is going to be more. If you go back to 2016, when we had the state budget crisis, all the state agencies, the appropriations were cut. Certainly the health department, the state appropriation was cut in half. And we've not recovered from that. We're better than we were then, but it's been small increments. And unfortunately, our state appropriation is the smallest of all state appropriations in the Southeast. When we look at state dollars per capita per year, we're really the caboose. And it's just, and those state dollars are so important in running our county health departments. Federal grants account for 80% of our budget. What we generate in clinical services and fees generate about 15%. Our state appropriations about 5%. But our clinical services and our state appropriation are what fund the county health departments, as well as some counties do give us an appropriation. Not all counties, but many counties do. And that's what keeps us open and going.
Have you done any data at all as far as, or planning on doing any data as far as post-Dobbs on the pregnancies that go through? And as far as the numbers increasing or decreasing?
Right. I had projected about 5,000 conservatively more live births than normal per year, just based on the normal terminations we were looking at before. Looking at the first quarter post change in row, we've had at least 1,000 fewer terminations. So we're probably going to be on track for that 5,000 more babies that we all need to take care of, and their moms. And that's, we just need to step up and do it.
I think you've alluded to this, but real quickly, we have about 30 seconds left. Postpartum and that debate coming up in the legislative session.
It shouldn't be a debate. This is not Medicaid expansion. This is continuing services that pregnant women under Medicaid are currently receiving under the public health emergency that will lift in April. And if we don't do something, if we don't make a decision, then we'll be one of 2 states in the nation that have either not expanded Medicaid nor extended postpartum 12 months. We got to do better.
Merry Christmas, sir.
Merry Christmas. Thank you so much.
You got it.